Greetings everyone, and welcome to today's talk on postpartum, hosted by Tallahassee Memorial Healthcare. We thank you all for joining us for this year's virtual baby and family fair and look forward to talking with you all about this important topic today. I'm Trishay and I'll be your moderator for today. I am a mother of two and I am a fiance, so I'm excited about that. I wanted to introduce myself and let you all know who is speaking with you all today. We have also an organization called Melanin Mothers Meet, where we provide safe spaces for brown mamas to be themselves without judgment and to make sure that they're able to have a space for different resources and opportunities. So thank you all for joining us today. I am joined today by a panel of incredible experts. I've been telling them all morning, and they're all from all across the TMH facilities. And first we have Dr. Kelly Forsthoefel. She is an OBGYN at TMH and the Gynecology and Obstetrics Associates of Tallahassee. She's great. I can't wait to hear from her. And we have Lisa Whiting. She is a physical therapist and a pelvic floor specialist. I need to talk to you myself at TMH. And we have Heather Lincecum. She is a licensed clinical social worker and administrator of the Tallahassee Memorial Behavioral Health Center. So so excited about the panel. And then last but not least, we have Miss Kitty Draa, and she's a labor and delivery nurse at TMH. Very important piece to the puzzle. So thank you all. We're so happy to be here with you today. Whether it is your first time or having a baby or your third, every postpartum experience is a lot different than the one before, let me tell you, or maybe let me not. But it comes with its own challenges, so we're privy to that. Today is all about unpacking the things people just don't talk about enough when it comes to postpartum. So we want to help equip you with the knowledge and tools you'll need to feel as prepared as possible for life after your pregnancy, or what our group, we like to call it the fourth trimester. Before we begin, if any participant has questions, please submit them using the Q&A feature in the Zoom. We'll be monitoring them as they come, though, answering in real time. So let's get started. First, let's talk about postpartum depression. For Dr. Forsthoefel, let's start with the basics. Having a baby is extremely hard on the body. So, what happens to women's bodies physiologically after giving birth? What can moms expect?
Physiologically, of course, you just pushed out a baby. So it's a very, very big strain on the body. But the biggest thing that's going to happen that's going to really make all your postpartum changes is you have this really big hormonal shift and you have this really big fluid shift. So those two things are really going to cause all your physical changes that are going to happen postpartum. And so I think that's probably where we're going into kind of what physical things that we can expect in that postpartum period. And all of them are really going to stem from that hormonal change and that fluid shift.
I see. And so what are some of the big changes or symptoms that surprise moms after birth usually?
So immediately after you have baby, you might start getting those shakes and those chills. I feel like women are very surprised about that on the labor and delivery floor. And we don't really know exactly what the reason is. Again, they've speculated that it is this really great hormonal change where all of a sudden you have lots of hormones in pregnancy and then baby comes out and they drop significantly and very rapidly. You have that fluid shift, you have that temperature change. And maybe it is just some adrenaline because you just pushed out or, had a C-section, delivered a baby. So really that's one of the big things. It is normal. Usually it completes and is done within a half hour. Sometimes can extend to an hour, but it is a normal reaction to get your whole body to be shaking afterwards. Other things that can happen, your uterus immediately will contract down and you might feel that. So you'll feel that pelvic cramping when you're on the labor floor. And it's a normal reaction. Your uterus is trying to dislodge and release that placenta and deliver that placenta. And it's also trying to protect you, right? It's trying to prevent postpartum hemorrhage. And so even 12 hours after delivery, your uterus is already down to your belly button. And at 6 weeks postpartum, it's back to normal. It's about the size of your fist. So your bodies are amazing in how their ability to kind of get our uterus down to normal and protect us. Other things, you will be bleeding after you deliver. Again, that's a normal reaction of your body trying to kind of shed that pregnancy lining. And the bleeding might surprise women because at first it's bright red as expected, but it really does change throughout the postpartum period. It can go to dark red, it can go to brown, it can even go to white. And, around 6 weeks is when we expect that time to kind of stop having that discharge. But again, throughout the postpartum period, you'll notice it gets more when you stand up or there's gravity, or you push down when you use the restroom. And so throughout the day, it might change, but overall, it should get less and less every day. Our breasts certainly change after delivery. In the first few days, your breasts will secrete what's called colostrum, which is that milky, thick substance coming out. And then around 2 to 5 days afterwards, you'll get very engorged, and then your milk will come in. And so our breasts significantly change in that period. Your belly, so your abdomen, it might not be as tight as what it was before delivery. Certainly, if you had stretch marks beforehand, they might not go away right away. They can certainly lighten over time, but may not completely go away. And then, it does take several weeks for that abdominal muscle to kind of come back together, and it might come back together very nicely. And for most women it does, but other women, you might have some kind of weakening of that abdominal lining, which can lead to what's called diastasis recti. And so that's certainly something that we do utilize our wonderful pelvic floor physical therapists for to help us with in the postpartum period. Other small things you might recognize: in a few weeks or a few months, you might lose a lot of hair. And that's, again, that big hormonal shift. You do gain a lot of hair when you're pregnant. So sometimes I think it's just that extra hair that's kind of being shed. You might have some skin color changes like melasma, which is maybe on your face, or that linea nigra, which is on the abdomen. And that should lighten with time, although they might not completely go away. So these are just very common things that might happen after delivery that you might be a little bit more surprised to see.
Yeah, things to think of when thinking of a family. Wow, that was really great. Okay, so a couple more. Many moms don't really realize they can develop conditions like postpartum hypertension after delivery. Can you talk a bit about that?
Right. So a lot of times women develop high blood pressure in pregnancy or while they're delivering. But yes, it is possible to deliver or to develop blood pressures after delivery, which is a little less common, but not unheard of. Normal reaction to our blood pressures is going to lessen or normalize right after delivery. You might have a very acute increase of your blood pressure right after. That might not be something called preeclampsia. It could just be this transient increase. It could be because you got a lot of fluid during your delivery or C-section, maybe the medicines you got if you did have extra bleeding, some blood or some pain medicine like high doses of ibuprofen or Motrin can sometimes affect blood pressure. Even pain can affect blood pressure. So, your blood pressure might transiently or shortly increase, and it may not be a big problem, and it can resolve on its own. But when we do see high blood pressures after pregnancy, we do want to keep in the back of our mind something called postpartum preeclampsia, which is very similar to preeclampsia before you deliver, or high blood pressure pregnancy before you deliver. And we manage it very similarly. We give blood pressure medicines. We do have a little more in our arsenal after you deliver baby to how we can control your blood pressures. We do give medicine. We might keep you in the hospital and monitor your blood pressures. we might give medicine through an IV to kind of make sure we don't develop scary things like seizures postpartum. And we certainly follow up with you much closer afterwards with, office visits, home blood pressure monitoring. And the goal is to really get you to a point where you're not taking blood pressure medicine all the time. A lot of times within 2 or 3 weeks, our blood pressures end up normalizing. Sometimes they don't. When you do develop these blood pressures, you have that risk of continuing to have that after this acute postpartum period and developing high blood pressure outside of pregnancy. In which case, we do try to get our primary care doctors involved. And then certainly, if you are a preeclamptic and you normalize, you are at risk for having high blood pressures again later on in subsequent pregnancies. So we want to watch out for that later on and make sure we watch you more closely in your next pregnancies.
Wow, that is a lot. That is a lot you have to keep up with. So with that, what should moms be doing during or maybe even before their pregnancy to prepare their bodies for delivery? Because this information alone is a lot.
It is. I think pregnancy classes are extremely helpful. I think it teaches you relaxation techniques. It discusses, how to breathe in labor, how to relax your body in labor, different laboring positions for what your goals of delivery might be. So I think that just being prepared with, more information, going to classes, there's online classes, there's classes here at TMH, there's classes all over the city, and that are able to kind of give you more information. And of course, utilizing your OBGYN and your other resources, maybe doulas and so on and so forth, to give you more information about what is coming and what could be happening postpartum. Certainly resting up before delivery is important. You're about to have a baby. It's a lot of stress on your body. It takes a lot of energy. So trying to get your energy up by resting beforehand, because maybe after delivery, you might not be sleeping as much as you did before. Eating healthy is important. Lots of snacking during the day, lots of hydration to keep your energy levels up. Keeping moving is very important. Exercising and keeping your body fit. Things like walking or swimming, stretching, yoga is excellent, helps open up that pelvis for nice vaginal deliveries, or even, just getting that baby nice and well engaged. Some people do squatting, although, be careful. Sitting on those exercise balls to really give you that nice pelvic tilt to promote a nice engaged baby and promote a nice vaginal delivery. These are all really good utilization, good tools you can use to try to prepare you for going into labor. Certainly, like relaxation techniques, meditation can be helpful to prepare your body the stress levels that it might go through, both in labor and postpartum. And then perineal massage is something that some people use. I know that a lot of women are very worried about tearing during delivery or potentially getting something like an episiotomy. They have shown that if you have started doing some perineal massage about 34 weeks and on, just to kind of stretch out down there, it can potentially decrease the risk of needing an episiotomy and may decrease the risk of needing sutures down in there or stitches down in that vaginal area later on after delivery. So these are just kind of things that maybe you think about when you're pregnant. Certainly, we want to be our healthiest self before we become pregnant. So seeing your gynecologist or primary care doctor prior to pregnancy, making sure your glucose levels are under control. We don't have things like diabetes, or if we do, it's under control. Our thyroid is under control, and so on. Our weight is under control, so on and so forth, to make sure we're our healthiest selves to really make the healthiest baby and healthiest pregnancy as possible.
Nice. What about the moms who experience the cesarean deliveries or C-sections? How might their bodies change after delivery?
So it kind of depends a little bit. Some women are scheduled C-sections. Some women do go through labor and then they end up having a C-section. And I certainly think there is a big difference between the two. Women that go through labor and then have a C-section certainly feel probably things that are from both, right? They might have vaginal lacerations or perineal pain that they would if they had a vaginal delivery. And then on top of that, they might be dealing with some of their C-section issues. So I think there's a bit of a difference. However, you could potentially have all those symptoms with either modes of delivery. With a C-section, usually we do a side-to-side incision on the belly. So a scar would be side-to-side in that bikini line. We do want to try to hide it so that you can use your bathing suit and not have that kind of out to the public. You don't want to. And so we do try to hide in that bikini line. There are emergency situations where we have to go up and down, or certainly if you've had a surgery before that was up and down, we wouldn't like to give you an additional scar. We would like to use the scar that you were in. But the C-section scars, they can have stitches in them that dissolve on their own. They can have staples in them potentially. If there are staples, they are generally removed prior to leaving the hospital, but can be in there for up to a week or more, depending on the situation. And when you get home, you expect that the first couple of weeks after a C-section, you really might not want to be doing a lot of strenuous activity. We really want to make sure that skin heals very nicely and we're not disrupting that scar in any way. And so you generally do see your OBGYN a couple weeks after to make sure we are healing at least on that skin incision. And then after that point, your gynecologist might tell you, okay, I think it's safe for you to maybe start massaging the scar or applying scar cream. And they might have you have clearance to kind of move around a little more, be a little more active to kind of bounce back a little more, maybe using things like an abdominal binder to kind of keep things in, but really want to make sure we have clearance from our doctors before doing any of those things. Some people do have keloids. We don't really know why people do that. Sometimes it can be genetic, maybe not. If we know that beforehand, we can do things like inject steroids sometimes to help prevent that from happening. But whether that happens and that would work is kind of dependent on the person. And there are many things like scar creams that can help with these incisional scars. We just kind of have to manage our expectations a little bit. Sometimes they may work, sometimes they may not. And sometimes we have to be careful about what kinds that we use. Some include things like retinol, which we certainly don't want to be a part of our regimen when we're doing things like nursing our babies. So, a lot of the C-section versus vaginal delivery is going to be kind of helping that scar to heal and helping your body to heal in a little bit of a different way than a vaginal delivery.
Right. Gotcha. Wow. So you can get that bikini on, right? Well, we talk a lot about childbirth and delivering your baby, but that's not exactly the finish line. Can you talk a bit about delivering the placenta and what moms can expect there?
Sure. So sometimes our bodies do it for us. Okay. Sometimes, you have that uterus that contracts on its own. And then the placenta releases very naturally, and you might push once or twice, or maybe your OBGYN pushes on your belly once or twice, and it might come back out very easily. Sometimes it takes a little bit of time. It might not be immediate, up to a half hour or an hour is not necessarily abnormal. Sometimes we have to wait for the placenta to give it time to release. And like I said, your OBGYN might have you push a couple times. Sometimes they will massage your uterus, and that's just trying to make it firm up to release that placenta. Sometimes we give what's called oxytocin, which also is a way that we can chemically try to help the uterus clamp up in order to release that placenta. And again, it's all going to be releasing the placenta and then kind of clamping on those vessels so we don't have any bleeding or we have minimal bleeding afterwards. There are times when the placenta doesn't come out very well, or it needs a little bit of help, and it is extremely uncomfortable. But sometimes we have to go in and physically remove the placenta, in which case we try to give pain medicine beforehand. Can you still hear me?
Yes, we can hear you. We can't see you yet, though.
Yeah, no, why it came off. I'm so sorry.
No, you're fine. Kitty, there you are,
Yeah.
Dr. Forsthoefel.
And then
Awesome.
Sometimes in extreme situations when we're not able to release the placenta, or unfortunately part of the placenta stays in place, we may even have to do things like remove the placenta in the operating room. That is definitely an extreme situation. Most of the time, placenta is nicely released on its own with a little bit of massage and maybe a push or two.
Awesome. Thank you so much, Dr. Forsthoefel. Kitty, let's talk about that first pee or bowel movement following birth. It can be a doozy. What can moms expect and what helps?
Yeah, it can really be kind of anxiety producing to let something else come out of that same area that the baby just came out of. So as far as that very first time that mom gets up to go pee, we give them a plastic water bottle. It's like a squeeze bottle, fill it up with warm water. And as they start to even begin to release the urine, we have them spray it over their perineum, and it just helps rinse away and really can help with the burning that can cause, because that first void really can burn. As far as having, and I recommend they use that for several days postpartum until really things have gotten back to normal, started feeling more normal. As far as the bowel movement goes, especially if someone has a tear from delivering vaginally, that can be anxiety producing because they feel like they need to, push down to have a bowel movement. You don't want to push when you have a newly repaired perineum. So we'll offer a medication to soften stool and highly recommend that moms take that. It won't cause diarrhea. It will just help soften it and make it more easy to release. We can offer a sitz bath so that mom can just soak her bottom in the warm water and really help clean and calm that area. If a mom has had a C-section, it can even take a few days for everything to regulate and to be ready to come out. So, moms need to give themselves some time knowing and take that stool softener until their body is able to, and then use that water bottle.
Please.
Yeah.
In your experience also, what are some of the other big postpartum surprises that your moms experience?
I think a huge one is just the level of exhaustion. I think everyone knows they're going to be tired. We go through labor, we've had a baby, but you've essentially just run a marathon, right? For 10, 12, 18, 24 hours, and maybe sleeping, maybe not really sleeping. And so the level of exhaustion is huge. And not to mention now you've got a new baby who doesn't know what sleeping at night and being awake during the day means. And so you have to really, really find a new balance in that. And I do think that shocks people. They're like, I just didn't know I'd feel so tired. And then on the reverse side of that, I think just the pure joy that people feel. They know they're having a baby and they expect to be happy, but the good feeling of that, I think, is huge. It can even be surprising.
I agree with that. Definitely. Children do bring a different type of joy your way for sure. Also, Kitty, so media and movies teach us that moms and parents feel an instant connection with their baby after giving birth. That's not always the case though, is it? Can you talk a bit about that?
Sure. I would say it's not always. I mean, I think in general, as soon as the baby comes out, for the most part, moms are very happy to see the baby. But it's sometimes, especially if it was a more traumatic labor and delivery, sometimes moms almost kind of check out for just a minute emotionally. They have to kind of go inside themselves for a moment. And so then there isn't that sense of like awe and wonder quite yet, because they're trying to take care of themselves for that moment. But then they typically, come back and get to know the baby, and it's all as you would expect. But also I think sometimes that it's just the very newness of it all that they expect to love this baby, and yet they don't know this baby. And so it takes a little while of just being with them, loving on them, the closeness, the providing for them, and to fall in love. So I always tell parents, give yourself a minute, to fall in love, give yourself grace to not worry about it if you haven't immediately, that you're going to.
Wow, definitely. That's really great advice, Kitty. How can moms try to bond with her new baby if that's the case?
Okay. So one of the very first things we do when a baby comes out is we put that baby skin to skin. In the old days, the practitioner would clamp and cut the cord and hand the baby off, and somebody would take the baby to the warmer, and we would stimulate and dry, and then present the baby in a blanket to the mom, or maybe even to the dad, not even handing the baby to the mom first. But now, I mean, the baby comes out of mom and essentially directly onto mom's chest and stays there for that first hour. So it's that immediate reconnection. They were connected on the inside and now they're connected on the outside, hearing one another's, the baby's hearing the mom's heartbeat. They're breathing kind of together. They're providing warmth for one another. I just feel like in the years that we've been doing skin to skin, that bonding is just happening so much faster. So my first thing would be to say skin to skin. Another thing that really is helping with bonding is rooming in. You know, we don't take the baby to a nursery, so to speak. If the baby is healthy, then the baby stays right there in the room with mom and her support person. So that they're already starting to get to know each other. The baby's not spending extended periods of time away. Big advice I would say is to limit visitors. And I say that just because the more visitors you have, the more people you have, the more people that are holding the baby, and it's not you and your support person getting to know that baby. And I say that for the hospital, but even at home, and those first few days when you're really trying to get to know each other and rest and recover, is just kind of let it be you for a little while so that you can create that bond and form that relationship. But I really think the biggest thing is that skin to skin, just that closeness. You're immediately watching for cues to know when the baby needs to eat because the baby's right there on you.
Wow, nice. Building that relationship, that's very important. I don't think we ever get away from the skin to skin either as adults. That's still something that we enjoy. Heather, on this topic, something that catches a lot of moms off guard is postpartum depression. Can you talk about why new moms go through this? How common is it?
Sure. I mean, I think when we think of the birth of a baby, we think about excitement, joy, anxiety. We might be fearful. I think what's commonly not thought of is depression. And this impacts between 10 to 20% of new moms. And it's not just new moms, it could be a mom who's suffering from a loss. So I think it's more common than we actually talk about. I think women sometimes are hesitant to discuss it because of the stigma that's still associated. But it is something I encourage women to talk about with their provider as soon as they're noticing or having concerns about it, so that we can give them the proper treatment.
Wow, nice. What is the difference between the baby blues and postpartum depression, and when should moms seek professional help?
So, baby blues, I mean, we talked about hormone changes that are happening, rapid changes. So I think, baby blues is something that would be pretty typical for most moms to go through. You're talking about days or weeks after birth. You might experience, crying spells, irritability, there might be trouble sleeping. And again, I think all of those things are very normal. There's hormonal changes and you're taking care of a brand new, newborn. Postpartum, on the other hand, is more severe, a longer term form of depression. It may be mistaken for baby blues at first, but again, it's typically more impactful on your functioning. And without proper treatment, it could last for months or even longer. So it's really important, even if a mother suspects that mood is not improving, I encourage them to talk to their provider as soon as possible.
Wow, yes, please, definitely. Thank you. What are other postpartum mental health disorders that are impacting women?
So postpartum depression is the most common. We do see postpartum anxiety. A more rare condition is postpartum psychosis, but it does impact new moms. Onset of that is typically the first few weeks after delivery. We see a more prevalence of this in women who have a prior diagnosis of bipolar disorder or schizoaffective disorder prior to pregnancy. They have a greater chance of developing this condition. It does cause women to lose touch with reality, so it could, without treatment, be potentially fatal to not only them, but they may have thoughts of harming their baby. The good news is that treatment is highly effective. So again, I can't say it enough. I encourage women and their support networks to get them to proper help as soon as they're noticing these type of symptoms.
Okay, wow. Okay, so how long can moms expect to wait until they might feel back to normal after giving birth?
So this is not a one size fits all. So I think it's very dependent upon the mother, the circumstances of the birth, the medical complications, not only the physical complications, but the mental health complications. So I think, talking to their provider about milestones in terms of healing that they should be meeting, but really just take it day by day. It's mother by mother, right? It's
Right.
not the same. So I think we discussed giving yourself time to bond with the baby, give yourself time to heal, to kind of digest this new normal with this living being that's, now that you have to take care of. And again, just take care of yourself and give it time.
Wow, nice. So what are the risk factors associated with perinatal depression and mood disorders? Is there any rhyme or reason as to who is impacted?
It's not a character flaw. I want everyone to know that. Sometimes it's simply a complication of pregnancy, but there are a host of risk factors, that could, heighten someone's chance of having postpartum. Certainly women who have had histories of trauma, family histories of depression themselves. If it's an unwanted, unplanned pregnancy, if they're lacking support systems. I think some of the ones that are, most, it's good to look at the most is, again, history of depression. Women who have multiple risk factors. Again, women who have histories of major depression or bipolar disorders prior to delivery. And again, these are all things that, discussion with your provider, as soon as you can, will prompt, more effective treatment.
And Lisa, one very common thing mom faces after giving birth is problems with the bladder, weakness, and involuntary urination. Many moms may think that this is just their new reality. How common is it, and what advice do you have for those women?
Well, as far as how common it is, typically speaking, the research shows that about 32% of women have some form of urinary incontinence at 1 year postpartum. And, but it isn't a cross you must bear just because you've had babies. You have to really look at, what helps us with our continence. And, I treat patients throughout the lifespan, and you can experience incontinence throughout the lifespan. And so you have to look at the core. And most of the time people think that the core means the abdominals, but actually the core is the abdominals. So if you think about the core as a cylinder, you have the diaphragm on top, the pelvic floor on the bottom, you have your abdominals that wrap around the front, and the back muscles that are in the back. And it takes all of these muscles working as a team in order to maintain continence.
Oh boy.
It's more specifically urinary stress incontinence. And so that is not leaking with coughing, sneezing, jumping, that sort of thing. And so, really you have to think about the pregnant body. And these mamas, their bellies, their abdomens have stretched and grown over 9 months. And so now we're working with a muscle that has been lengthened. And so that muscle really, it's challenging for that muscle to work to control that pressure. And that's how that works with the core. And the pelvic floor also has high demands on it as well. And so because it's been, holding up baby throughout those 9 months as it grows. So that's why women have an increased incidence of urinary incontinence after delivery.
Wow.
And my advice would be, first of all, to allow their bodies time to heal, first and foremost. Also for moms to be, to just pay attention to their body. And if they feel like something's wrong, if they listen to their intuition, and if they sense there's something wrong or off, bring that to the provider to talk to them. And, to know that, there is help out there. And pelvic floor physical therapy is very effective in helping reduce urinary leakage. Kind of a little bit of a disturbing study I saw stated that women who were leaking at 3 months postpartum, 73% of women leaking at 3 months postpartum were also leaking 6 years postpartum. And so the message is that we want to make sure that women know that there is help out there, and it is not something that they will just have to deal with because they have babies. And a lot of times moms get that message from their mothers and grandmothers that, oh, well, it just happens. This is what we get for having babies.
Wow, I'm sure I know a few women that just went woo, like me. Excuse me. So do people need a referral to see you from a doctor, or how can they see you?
We do require a referral from a physician. That can come from your primary care doctor. It can come from your OBGYN. And yes.
Okay, nice. Awesome. Yes, that's very important information. I know a lot of people will be calling you soon. What symptoms should a mom look for to know that her pelvic floor is the root of the issue?
Okay. Well, as I said earlier, the pelvic floor is teamed up with the abdominals and the diaphragm and the deep core back muscles. And so we don't really always know without seeing a pelvic floor physical therapist and doing an internal evaluation to assess those muscles, whether or not the pelvic floor is the root cause. Patients might experience some pelvic pressure. They might experience some pain with intercourse, or they might experience some tailbone pain. And so those certain symptoms might help give us some clues about what's going on, and that the pelvic floor might be involved.
Nice. So if a woman is having problems with her pelvic floor, how can a pelvic floor specialist like yourself help? What does that look like?
Well, I treat not only postpartum, but also pregnancy and throughout the lifespan. And really what a pelvic floor therapist does first and foremost is helps a person connect their mind to their body. And that is the mind to the pelvic floor. When we are looking at other muscles of the body, typically we can see them contract, we can feel them, we can palpate them. But with the pelvic floor is so abstract. And so, and also when someone says pelvic floor, what's the first word that pops in your head? Kegel, right?
Kegels, definitely.
And so my big message is, if no one gets anything else out of this, is your pelvic floor relaxation is just as important as your pelvic floor contraction. And as any muscle in the body, we have to be able to contract that muscle, but we also have to be able to relax that muscle. And so relaxation is really important for the pelvic floor in order to birth a baby. And
wow, nice. So meditation for your pelvic floor. Oh, wow. That's so great. Okay, awesome.
Yes.
Kitty, while breastfeeding is natural and an incredible way to nourish and bond with your baby, it's not always easy. What are some of the challenges a mom may face while breastfeeding?
Well, first of all, I agree. It's the most unnaturally natural thing that we do, or one of them, because it is such a natural thing. Our bodies were created to provide nourishment for our body. So it's natural, they fit together, but mom has never done it, baby's never done it. And until we work with them and help them, a lot of times there's just so much unknown and work to do. So mom, challenge is to get the right latch to make the baby's, mouth fit appropriately on the mother's breast. So we can work with that, finding the right position that feels comfortable for the mom. And so that they feel like they have the best, hand control. And, there's moms with small breasts, moms with large breasts, trying to find the way those need to fit together. A challenge for moms might be privacy. Are other people in the room? Do they not want to nurse? If there's other people, are they out in public and they feel discouraged or, inhibited that they shouldn't do that and don't have a proper, cover up. And then, a lot of moms are very concerned about whether their baby's getting enough milk. With bottle feeding formula, you can actually see how much goes down in the bottle, but with breast, you can't. The baby nurses until the baby is done. And then you watch their weight and their pees and poops, and that helps us know. But other than that, there's not that concrete evidence. But challenging, yes. But once you get the hang of it, I always tell moms, I'm like, once you get the hang of it, you'll be walking around the house, putting that baby on your boob. You won't even think twice about it.
Right. Plenty of times we're baby in one arm and spoon cooking on the stove in the other.
Right.
Awesome. Yeah. So what advice do you have for moms having trouble breastfeeding? How can they set themselves up for success?
Okay. Setting it for success, first of all, is taking that prenatal breastfeeding class. So even before you come into the labor room, you've already have learned a lot about breastfeeding, about what it is and what you can do. And then afterwards, I know I'm driving home that skin to skin, but having that baby close to you, because then you start to see the cues and you know when the baby needs to eat, and then you put the baby on the breast. So watching those cues for the baby. If in hospital, and there are, we have all of our labor and delivery and postpartum registered nurses are extensively trained in breastfeeding. And so we are the first line of defense with that, and can help 24/7. And then if there is an issue that's more than perhaps what we are able to help manage, then we can call a certified lactation consultant to come to the bedside, and they can give even more advanced assistance. And then once you are discharged from the hospital, you can do the outpatient lactation consulting, they can come to the hospital to do the class, it's like a support group. And I think they may even do home visits. I know they did. I'm not sure about right now with COVID. I think a huge thing is just keep doing it, sticking with it, just knowing this is how I want to feed my baby, and I'm going to. At the end of the day, the most important thing we want you to do is feed your baby. Okay. So one way or the other, we want you to feed your baby. But just having that determination, like, I know this is natural. I know I can do this. We just have to find a way to make it work between me and my baby, and just being consistent.
Right, definitely. Heather, bringing a baby home can definitely shift the dynamics between mom and her partner. What advice do you have for couples navigating that?
I think just honest and open communication, continuing to be in tune with one another, even when you're tired, encouraging one another to share how they're feeling, to share when there's challenges. We talk a lot about mothers going through lots of changes. Dads equally go through things as well that sometimes we don't talk about, and sometimes they're not always readily, they don't readily open up about them. So I really think, as in any situation with couples, whether it be a new birth or navigating a new relationship, communication is key. As much as you can split responsibilities or give one another breaks. Communicate, navigating through this new world, because it's no longer a party of two, but it's exciting. And so just finding ways to connect with one another and being open, I think is vital. Reach out to support networks and other couples who may be experiencing similar, so that you have that support network built up. But again, I can't stress enough, just really communicating with one another.
Right, I get that. So when is sex back on the table? How might sex look or feel different than pre-baby? My favorite question.
So in the postpartum period, especially if you had a laceration or an episiotomy, you might have some of that scar tissue there. So it might not feel like the vagina that you were used to beforehand. So sometimes just having that realization prior to can kind of ease some of the anxiety and the surprise. of what might be coming. Certainly the first couple of times might be a bit uncomfortable. One, because of that scar tissue. Two, like Lisa said, your pelvic floor is completely different potentially. There might be more relaxation, there might be more tension there. Three, our body kind of goes into this pseudo menopausal state because we don't have all those hormones that we do while we're pregnant and pre-baby. So a lot of times we have a lot of dry vagina, especially if you're someone that's breastfeeding, because that return of that estrogen to your body doesn't come back until much later. So you might feel a dry or gritty sensation, which is certainly uncomfortable. Things like vaginal lubricants can help with that. Sometimes if it's really severe and the lubricants aren't enough, we can give you like some estrogen cream to kind of help with the some comfort and more comfort during sex. It is unfortunately something that may take a couple times to get a little more used to, but many women do kind of get back to that time where they are enjoying sex. It doesn't take forever, but we certainly don't want to do it until we're healed. So we do have you come see your provider before kind of clearing you to have sex, making sure we do a good exam to make sure that we're completely healed down there and it's safe for you to resume your sexual activity.
Very important. Thank you so much. We're going to go ahead and move to the question and answers. Our first question, and we'll open this up to the entire panel. If baby is not getting enough milk breastfeeding, how do we know how much formula to supplement in the meantime? And then with the lactation consultant on day 2 or 3. So I guess, are we seeing a lactation consultant on day 2 or 3? And also, how much formula do we supplement for breast milk?
I would say as far as the supplementation, if you're in the hospital, you're gonna talk to your nurse right away, because that's kind of based on how old the baby is. And so they'll help you figure that out. If you've already gone home, then you're gonna be talking to your pediatrician about that for guidance about how much is appropriate. And then when to see a lactation consultant. Well, that's just really going to depend on what's happening with you and if you're working with your nurse. I feel like, I've called lactation consultants from the labor room, and that's only 2 hours after within 2 hours after delivery. So it would really just kind of depend. You're working with your nurse, and then together you decide if you may need to move to the lactation consultant anytime in your postpartum period while you're in the hospital.
Okay. And so if a person doesn't have health insurance, are there other ways to receive assistance for the services?
Do you know which services they're talking about?
I'm thinking maybe the lactation consulting services, or I'm thinking that's what they're talking about.
As far as I know, I don't know how that's charged in the hospital, but we don't talk about money as far as when we refer to them. We just call and say, hey, can you come down to room 201 and help this mom? So,
Katie, do you know if they still offer the breastfeeding support groups a couple times a week?
I don't know if they have resumed that or not. I think they may have even been doing it virtually for a while. I haven't heard one way or the other. Yeah, it's through a women's place though that's on 6th Avenue, so anyone can call there and talk to them. I know I went with both of my children. It was a fantastic resource, and I highly recommend it.
Okay, and what signs of postpartum depression do you suggest others in home should look for? That's a good question. And that's anyone.
I just look at overall functioning pre-post baby. Are you sad more hours out of the day than not? Are you so depressed that you're not able to get out of the bed, shower, eat? I'd really look at functioning. And even if, someone is just suspecting that something's not right, that something's off, and I would say communicate with your partner. If you're not able to get that much, encourage them to go seek help from their provider so that, you have an objective, source to kind of discuss these things. There's never any wrong in getting to help sooner rather than later.
Definitely. Thank you, Heather. Is there any emerging research on consuming the placenta encapsulated?
Not that I'm aware of, honestly. I don't have a good resource to give information on that, honestly. And that's to be helpful or not helpful. It's still kind of in the works and finding whether that's something that can be useful or not.
Okay, thank you so much. And then also, if you are needing to know more about the birthing classes, breastfeeding classes, and breastfeeding support groups that Tallahassee Memorial Hospital offers, you can find it at tmh.org/classes. So that brings us to the end of our time today, and we hope you also join us for the remainder of our Baby and Family Fair virtual speaker series. Our next webinar, Recognizing Early Signs of Autism, is tonight at 5 p.m. To see our full lineup and to register, visit tmh.org/fair. Thanks so much for joining us today. Thank you, everyone.
Thank you.